The vaccination program against COVID-19 has started today, with the main event being at Mulago National Referral Hospital amidst longing from different people.
It is now my honor and a pleasure to launch COVID-19 vaccination in Uganda. For God and my country.
The vaccination was received by different people who we managed to talk to, including the Minister for Health, Jane Ruth Acheng.
It wasn't really painful. There was a small prick like a mosquito bite, and before I knew it, it was done. I think they are experts and they are doing a good job. I also have my vaccination card. I needed to come back after 8 weeks for the second dose. I want to encourage all of you to get vaccinated. There's nothing scary about it. It's just an injection.
Every vaccine practice, every exercise of vaccination, you'll always get people who are negative and then you get the people who are pro. But what we want to say is that this vaccine is safe and it saves lives.
The first Deputy Prime Minister of Uganda, Moses Ali, encouraged all Ugandans to take the vaccine, saying that it is safe for all Ugandans.
Please desist from circulating information from unofficial sources. Tell the population the truth and encourage them to go for vaccinations. In this way, we will be saving the lives of our people and building our nation. Finally, vaccination is voluntary and free of charge. Remember to continue following the COVID-19 SOPs to prevent spread of the disease and death as COVID kills.
The Minister of Health, Dr. Jane Ruth Acheng, reminded Ugandans that COVID-19 is still prevalent in the country and therefore cautioned them to continue following the Ministry of Health guidelines in the prevention of the deadly virus. This comes at a time when 334 Ugandans have succumbed to COVID-19 and over 40,000 already victims.
Ugandans are assuming that COVID is no longer with us. But the people in the isolation unit in Mulago can testify that we are still getting cases, and some are severe and they are succumbing. And so I want to remind Ugandans that while we reached our peak and plateaued and dipped, there is a likelihood that we can go into the second wave of the pandemic. And therefore, it is important to remain on alert and take care of your health.
The minister said that they have started with the health practitioners because of the huge responsibility they have and also because they are on the front line in the fight against COVID-19.
All health workers from public, private not-for-profit, and private health facilities will be the first group to receive the vaccines. This is because they are at the front line, as you have heard from the various speakers, in response to the COVID-19 pandemic and are vulnerable to infection, as has been shown by the statistics of infection. We have over 1,900 health workers who have been infected by COVID-19, 19 of them succumbing to death.
The permanent secretary in the Ministry of Health, Diana Atwine, applauded all those that have gotten involved in the vaccination program and encouraged all Ugandans to get vaccinated, saying this is the true vaccine.
We just want to say the vaccine is safe and effective and embrace this vaccine. To everyone out there we have not reached, we are beginning with the health workers. We shall go in stages as vaccines get available, because every life matters.
The Belgium ambassador in the East African region, who represented other ambassadors in Uganda, has also applauded Uganda for the determination showed in the fight against COVID-19 compared to other surrounding countries.
Here, in a country that has listened to the scientists, that has really taken up this challenge and put forward excellent results, not only in the world, but even in the region here. If you compare with many other countries in the region, I think that Uganda really stands out.
The World Health Organization representative emphasized the importance of this drug.
COVAX vaccines are safe, and COVAX vaccines save lives. And until we're sure that everyone equitably receives the vaccine, the world will remain a hostage for this virus.
He highlighted 2 reasons why every Ugandan should be immunized.
The sooner we reach there, the sooner economies and social services, education, everything will get to semi-normal or normal. The other is this virus is one of the fastest changing virus. Various variants have started coming up. And the more variants come, the more it will be difficult for the vaccine to be effective on all the variants.
The UNICEF representative in Uganda, Munil Safliddin, has appreciated Ugandan doctors for the effort put in the fight against the virus, as he explains.
COVID vaccines are safe. COVID vaccines save lives. The first shipment has already arrived here in Uganda, and UNICEF, on behalf of the rest of the COVAX facility members, will make sure subsequent shipments of vaccines will reach the country very soon. The plan is to have more than 3 million doses of the vaccines from COVAX facility arriving here in Uganda by the end of May.
This story has been compiled by Isa Chigongo for Channel 44 Prime News.